Just now from Capitol Hill. Congressman, we talked about it about an hour ago in the 11 o'clock hour. We said, all right, you've got this fine now. Who's going to enforce that? How are you going to enforce a fine on people that do not have health insurance?
Well, it's really a tax. It's an individual mandate tax, and so they have empowered the IRS to enforce that tax just like they do all the others in America. And the Congressional Budget Office estimates it'll cost about $10 billion to hire people to fulfill the obligations the IRS has under this bill. And they expect about 16,000 more employees so they can go track everybody down, because even if you're without health care for 1 month, you're going to pay 1/12 of that tax. A fine implies that you might be able to get out of it, but this is a tax. You're not going to be able to get out of it. And I think just Americans are going to have to get ready for the IRS being in a part of their personal health care decisions that they have not been before.
And I don't know the average hourly income, equivalent. I know they're salaried, but if you were to put IRS agents, broken down on an hourly wage, I would venture to guess that it will cost the American people exponentially more to have an IRS agent go after a poor family to get their $325 fine.
Well, they're going to have to get a 1099 on every individual in America that has health care, and then go through the documents for 300 million Americans to audit and make sure they have the health care that the government has deemed acceptable. So it's not just if you have health care and don't have health care, it's just the health care that you have has to meet the definition that the federal government's going to give. And so they're going to have this huge audit responsibility and then this huge enforcement responsibility to go collect all this money. And it actually is going to cost billions and billions of dollars. In the first 10 years alone, $10 billion. And of course the bill, as your reporting has explained, gradually comes into play and won't be fully enforceable for many years, certainly after the next congressional elections and after the next presidential election.
Yeah, because it seems, $325, even $500, $600, I could see a situation where you're going to spend, $5,000 in IRS man hours to go after a low-income family to shake them down for their $500. So either you don't get the $500 and just let it go, right, or whatever it might be, or you spend $5,000+ to have an IRS agent come down on a low-income family. It seems that either way, the taxpayer is going to lose in that situation, Congressman.
Well, yes, they are. And not only does this individual mandate tax get enforced by the IRS, but now you've got state attorney general across the country suing, saying the federal government does not have the authority to make you buy a product and then tax you if you don't buy a product. So this is going to play out through the court system, I think, for some time. And that's why our approach was to try to incentivize people to buy health insurance. We had a totally different approach. Rather than a central planning and command and control from Washington, D.C. and on the IRS, we thought it was much better to try to incentivize people to buy health insurance and actually help lower their premiums. This bill will actually increase their insurance premiums over time.
Well, as far as the legal challenge goes, that's going to be hard, though, right? You are legally obligated to buy car insurance if you want to drive. You're legally obligated to have homeowners insurance if you want to get a mortgage. Aren't those also forms of tax?
It's very different, and because you've got state governments with that responsibility, and under our Constitution, it's a very different prospect than having the federal central government require that. And they don't require that you buy the product, they just require if you do buy the product, you have to meet those conditions. Here, they're requiring that you buy health insurance and then taxing you if you don't.
What do you expect? You might have heard Rich Edson say there could be some changes coming in this bill. Do you expect, Congressman, I know it's out of the House's hands, any meaningful changes, or is pretty much what we saw pass last night what we are going to have in law for years to come in the United States?
Well, I think they have an opportunity in the Senate to make some significant changes. Obviously, the attention has been on all the special deals and all the deal making, and I would say the ones that have gotten the most attention, the Cornhusker kickback and Gatorade, those are just some of them. Under this bill, union members get taxed at a lower rate than non-union members. And that is just, there's something fundamentally unfair under our system of government. And I think you'll see the Senate attack some of these other special deals in the bill that actually, I think, have significant policy ramifications. That's one of them.
Yeah, you know what? I actually sent out a tweet last night, Congressman, saying any hedge fund in New York or the world would be happy with the ROI, the return on investment, on some of those vote deals that were made when you squeaked by for a couple of votes.
Oh, yeah. I mean, the Louisiana Purchase in this bill is vastly much more than we paid for it when we got 1/5 of the landmass of the United States. So, yeah, these were not exactly dollar value items in the bill. And the people who suffer are the American taxpayers.
Congressman Dave Camp of Michigan, I'll let you get back to work, sir. Thank you very much for joining us. Appreciate it.
Thanks for having me.
All right.